Start out lying on your back with something supporting you along the length of your spine. This could be a yoga bolster, a pillow, a rolled up towel, or blanket. Make sure that you have something behind your head so that your neck is in a neutral position without straining. Now place your arms out to your sides. This could be down by your sides at a 45-degree angle all the way up to 90 degrees perpendicular to your body. The higher you're lifting your arms, the more stretch you'll feel across the front of the chest. So find a position that really feels comfortable where you can relax the arms and let them comfortably rest on the floor without straining or too intensive stretches. This is really good for opening up the front body and counteracting a lot of the forward rounded postures that we're maintaining, holding and feeding baby and changing diapers, and just letting there be some postural correction here. Now take a moment to settle into your body, to settle into this moment. We spend so much time planning, calculating, multitasking. Just start to really check in with how you're feeling here right now. Bring your attention and your awareness to your breath and start to slow the rhythm of your breathing, finding even inhales and exhales in duration. So inhaling for a count of 3 and exhaling for a count of 3. You can stay just with your attention to your breath, or if it is something you'd like to explore, you can start to add in gentle pelvic floor and core contractions with your breathing. As you exhale through pursed lips as though you're blowing out candles, think about squeezing and lifting the pelvic floor. And then as you inhale, allow the belly to relax and imagine the pelvic floor lengthening. Exhaling to squeeze and lift. Inhale to lengthen. If you're newly postpartum, it is perfectly normal to feel very little awareness in the pelvic floor and difficulty connecting to that region of the body. So if it starts to stress you out, just ignore that and return to that slow, steady breathing pattern. Breath work does help activate the core and the pelvic floor even without intention. So don't worry too much if it's difficult for you to find that awareness of your core right now. Let's switch to focusing on the shoulders. Give yourself a big hug and then let the arms come out to 90-90 goalpost arms. So your elbows are bent at 90 degrees and the fingertips pointing up overhead. Alternating to give yourself a hug and then opening the arms. We're just starting to open again the front of the chest and shoulders that can get really stiff. Another option is making snow angels on the ground. And you may notice it to be difficult to keep your hands on the ground here. Again, this is kind of just nice to help to reset the postural muscles that can also influence breathing, that can have an after effect downstream on the pelvic floor and core, helping to reduce neck and shoulder tension as well. So again, either opening and closing the arms, giving yourself a hug, or snow angels here. Next, we're going to work again on getting out of that forward head posture. Place the hands behind the head and make like a double chin, like you're pushing the back of your head towards the floor. You can remove the pillow if you have that mobility and it's comfortable. Keeping the elbows wide and really lengthening the back of the neck. You have an option just to stay for a sustained stretch or to lift and lower, mobilizing the thoracic spine and the upper back. And then just rest.